Hello and welcome back to GP Video Podcast by Nadia. You may have one of the 7 symptoms of low magnesium, but you would not know about them until you know that you have low magnesium levels and your symptoms are connected to low magnesium levels. Otherwise, they will be misdiagnosed because at least 48% of people in developed countries do not get enough magnesium from diet. So what are the 7 symptoms that you could be suffering from, and they should be or would be or could be attributed to low magnesium? Number 1 is muscle spasms and muscle cramps. So it starts with muscle spasms and muscle cramps. So magnesium is required for over 300 different reactions in the body, in particular the reactions that happen between the neuromuscular junction. So if there is not enough magnesium, the signals that travel through our nerves to our muscles can get disrupted, and neuromuscular junctions can become hyper-excitable, leading to muscular spasm and cramps. It can also cause involuntary movements. So if you're experiencing muscle spasms and cramps and involuntary movements, apart from other diseases, one of the important factors that can be very beneficial to look into is low magnesium. Number 2 is apathy. Apart from hyperexcitability, patients with low magnesium can also manifest apathy, meaning a lack of interest or energy. So if you are suffering from fatigue, it could be because of low levels of magnesium. We know that low levels of vitamin D, B12 and iron can very well relate to fatigue, tiredness and lethargy, but now we know that low levels of magnesium can also be attributed to fatigue. Number 3, extra heartbeats. Magnesium has, as we said, that magnesium has a good role in the neuromuscular junction. Similarly, it has a crucial role to play in the iron flexes across the cell. So if there is not enough magnesium, this process can be significantly affected, leading to extra heartbeats and, in worst case scenario, life-threatening arrhythmias. Number 4, broken bones. There is in human epidemiologic studies that there are some researches done that show that there is a correlation between bone mass and dietary magnesium intake, because magnesium and calcium are closely linked. So if there is not enough magnesium, often these patients don't have enough calcium. There is a correlation between both magnesium and calcium. So low calcium, low magnesium, low magnesium, low calcium, and that will and also it is tiered down to low vitamin D levels as well. So while for bones, higher levels of calcium and vitamin D are important, similarly, higher levels of magnesium are also important. And so if we have low vitamin D, low magnesium, low calcium, so we are causing further weakening of the bones. Number 5 is low potassium. So again, low magnesium levels are also correlated with low potassium. And because there is a thing called refractory low potassium, that is where the low levels of magnesium first need to be corrected before the potassium can come back up. So again, when you have low levels of potassium, you might need to first correct the magnesium levels so that the potassium can come back up. And again, low levels of potassium can also be related to malignant arrhythmias. Then number 6 is poor quality sleep. We've got a randomized placebo-controlled study showing that patients who took magnesium supplements had improved sleep time and sleep quality. Then number 7 is headaches. A final symptom on the list is migraine headaches. The American Migraine Foundation concluded that magnesium is probably effective in migraine preventative therapy. So the patients that are seen in the clinic that are suffering from migraine headaches are always should be checked for magnesium to see if there is a quick way to solve their problem. So I'll again quickly go through all the see, when I say that these problems can be attributed to low levels of magnesium, I'm not saying that they are going to be attributed only to low levels of magnesium. But the thing is that low magnesium levels can play a major role in it. So if you're having muscle spasms and muscle cramps and involuntary movements, of course there could be other diseases underlying, but when you correct the low magnesium levels, this can maybe actually solve 70% of your problem, or sometimes the entire problem. So while I'm saying that the low magnesium levels can be attributed to these problems, it doesn't mean that there are not other underlying problems. It means that correcting low magnesium levels can actually help you rectify the problem to a major extent. So number 1 is muscular spasms. Number 2 is apathy. Number 3, apathy, fatigue, lethargy. Number 3 is extra heartbeats. Number 4 is broken bones, because you can in your mind imagine that low levels of magnesium also correlate with low levels of calcium, low levels of vitamin D, and then low levels of potassium. And in potassium, sometimes if you want to correct the potassium levels, you might first have to correct the magnesium levels so that the potassium levels can also come up. And then we have got poor quality sleep. Again, apart from other sleep techniques, correcting magnesium or taking magnesium supplements, or even if your magnesium levels are good, but if you take more magnesium, that will correct the problem. And then headaches. So we'll talk about it more next time.